Good morning.
Good morning. My name is Olympia. I'll be your nurse today.
Right.
Can I go ahead and check your ID band, please?
Yeah, sure.
Right here. I just want to know you're my correct patient. Alrighty. Can I have your first name and your last name? And you can just say secret for your birth date.
March 25, 1996.
Okay. Wonderful. You're the right patient. It says right here, no known allergies. Is that correct?
Yes, that's correct.
Okay, so if that changes, let us know. Okay? As you know, you're going for surgery. And so what I'm going to do, because there's an order for blood draw and IV, is that okay with you?
Of course.
Let me wash my hands. As possible. You want to drop everything in your sterile field. Again, IV is what? Aseptic, correct? So I'm going to show you guys, hold on one second. How do you open the 4x4 to make sure to maintain the sterility? Can you guys see it? Watch me first. We're going to open all the way through. Do we touch anything on the inside? No. We're just going to go ahead and drop it in like this. Ta-da! So it should not flap, so you should supposed to what? Open it all the way up. Do not touch anything in the inside. You do not put any of your packaging. You grab your saline and you take this out from the packaging, correct? So how do you get rid of bubbles? You keep the syringe vertical and you aspirate all the way down. And what do? Flick the bubbles, and then what do? Make sure all the bubbles are what? Up in front, so you can what? Plunge it out. Okay? Remember, don't touch the tip. Okay, because then you break sterility. Then you lower lock it. Now, if your cap is too freaking tight, like the one they gave us, you kind of just loosen it, but you don't take it off. Okay? It should look like this. No bubbles in the syringe. One, tourniquet and wipe clean. So I would prefer to do tourniquet here. Ta-da! All right. Do we stick it in there wet? Or do we stick it in there when it's air dry?
Air dry?
Do we go like this?
No.
No, right? Do we blow on it?
No.
When we take this out, we break the seal. Step 3, traction. What is traction, ladies? It's the pressure you exert with your thumb, because that's the strongest, to keep the skin tight. And it's be towards you. Can I see your traction, please? Can I show you? And it cannot go in, you cannot touch the needle with your thumb this way, okay? So I don't want to see this, right? I don't want to see this. The traction should be out of the way. Okay, so now I'm comfortable with my needle. I have traction. That's step 3. Step 4, really target the vein, right? You guys spend time looking for the vein, feeling it, right? So you should be able to target the vein. So step 4 is target. Step 5, poke on top of the vein, inserting only 25% of the needle. 1 slide. Step 6, you need to stop. If you don't have flashback, just push this, okay? You guys see that? Do you leave the traction? Yes or no? Yes. Yes. Keep the traction there. You cannot move the needle without it. Okay, what's next? Lower it down, thank you. And then, yeah, 20-ish, 25. It doesn't go over 50 total, correct? First is 20, you add another 20, 25. Method A, what is method A?
One hand.
So I do not leave the traction. I hold on to the clear. The clear does not move forward. Does the clear move forward or backward? No. Okay? It stays there. Only the blue moves. forward. It doesn't move backward, it only moves forward. How do you move it forward?
With your finger.
With one hand, right here with the index finger. If you're having problems, then you can use what? 2 fingers, correct? One hand. Ta-da, and they should see the steel neck. You guys see that? What's next, ladies? So method B is when you're having trouble with method A, correct? So you're like, oh, I can't really do method A. So what do? Watch me, ladies. What do you do if you're having trouble with method A, or you just like, let go traction. Use the nail of your thumb, gloved. Hold on to the clear, because the clear does not go anywhere. It doesn't go forward. It doesn't go backward. What's next? Nail of your thumb. And then what do? Push the hub. There should be a ridge in the hub. There should be a lovely ridge in the hub where you're going to hold on to the clear and then just gently tread it off. That means slide it off, right? And it should look like this, okay? It should have a lovely needle neck. Do you see that? Before we remove the needle, what's the thing that we need to do? 2 things. Pressure and what? And tourniquet. So we did our A and our B. Now we're ready to remove the needle. That's the only time you remove the needles, correct? And you grab this. Ta-da! Do we wait for it? No. What's next? And connect it what? Right away, correct? Ta-da! And what do we do after we connect it? Let go pressure. What do we do? Hold the hub. Right? Hold the hub, and what do we turn? Only the clear, because it's gonna be a problem if you guys turn the hub. Okay, so you only turn the clear. Ta-da! Okay. And of course, what do we do next? Ta-da, ta-da, ta-da. Gently. Do we push it in or do we aspirate? We want to aspirate to make sure we have what? Lovely blood. That means you're still in the vein, correct? Do we push it in now, or what else do we need to do? We'll remove the syringe and make it vertical. And then we can flush it, correct? We can flush it right there. Okay? And that's how you connect the saline lock. Okay? It should look like this. And nothing should be out. All of the cannula should be all in there, 100%. Here we go, ladies. So before we take out the needle, we got to do 2 things, correct? What are the 2 important things so you don't bleed out your patient?
Okay.
So tourniquet, pressure, and then we can remove the needle, correct? Now, do we leave it hanging like this? No, we gotta connect your prime. You gotta connect your saline lock. If you turn the hub, everything will come out, okay? So you hold on to the hub and you turn the clear only. Does that make sense? Everything should be in there, okay? No catheter should be out. If catheter is out, that means you turn the hub. Again, in different settings, you might just what? Connect the what? The primary instead of the hep lock, okay? But in most inpatient, stay is about 3 days or more than we use the hep lock. Why? Because you can just disconnect. You can just disconnect the hep lock, and then your patient can walk over, walk around more independently. Will this survive if the patient moves? No, we need to what? We need to tape it up. Now the first thing you want to do is you want to reassure the patient. We're like 80% done. Please don't move. Right. At this point, they're irritated with you. But like, oh what? Right. I'm gonna show the tegaderm, the first tape to go in your IV. Now this, you can have it open already in your sterile field. So you can just grab it. Just So when you grab it, you just want to make sure that it provides a window. It's just like a second skin. We do not throw this away because this is the label. People do complain if it's crumpled. So what do? You have it stretch and stretch, just cover some portion of the whole of the hub, portion of the saline lock, and just make sure that it's not crumpled by following it with your finger. There it is. Ta-da, ta-da. Again, don't throw the label. Yay, there it is, ladies and gentlemen. So you can see, just, it provides a lovely window. If there's any complications, we can see it. Now, if it's a little blood, just wipe it off. Alrighty. So now we're gonna use our lovely tape that we did. So the first tape that we want is usually, you guys have a handout for this. Usually nurses stick with one. So if you do so stick your side up. And if you do a U shape, is what is it called, ladies? It's the U method. Now if you crisscross it, then what is that called? The chevron method. I know it should be a V method, but no. Chevron. So choose whatever you want to do. Okay? And then we're just going to frame everything around the tegaderm, just to give it extra support so it doesn't lift. So frame you again, we're using 1/2 inch tape. It's the 1 inch that we cut. 1/2 inch tape, the 1 inch that we cut right here. Do you guys see this? Ta-da! Yes. So the first one always is the tegaderm, right? Because it provides a window. It gives it a second skin protection, and then we have either the sticky side up that you can go whatever you want. H method, U method, chevron. And then we kind of just tape it around. We have a lovely border. Whenever we tape, we want to check for what? Patency, if it's flushing well, correct? Mm-hmm. Check for bubbles. And if it's flushing well, that means you taped it correctly where it doesn't occlude. Okay? So we're going to continue. So we taped around the site, which is important, but we got to stabilize this. I have a double port hep lock right here. And so I'm going to have to tape it in a way that it doesn't occlude. So instead of like having a sharp U like this, you want to do a nice big U, what I'm talking about right here. So you want to do all the locks. You want to make sure the locks are not taped, right? So you want to make sure, and you don't tape the ports, correct? You only tape this, and it's usually the neck. So I'm going to show you how to tape it so you don't, and you do not cover the window. Does that make sense? Mm-hmm. You guys are doing good. So right here, grab a neck so your coworkers can still access the ports. What you're going to do is called a kiss. So you take your 1/2 inch and you kind of just kiss it at the bottom. And then you flare it out. You see that? Flare it out. Again, the lock should be out of the way right here. And then nice big U. If you have enough skin, see this kiss right there? What happened is that when you pull it, it pulls on the kiss. Does that make sense? So let me show you the kiss again. Kiss is like this. This is the neck. This is the neck of the ports of your hip lock. So you just kind of grab it and then you circle around the tube. You kiss it at the bottom and you flare it. And then you kind of stick it in like this. Mm-hmm. And to even stabilize it even more, you're gonna what? You're going to provide another layer of tape on top of the kiss. So the kiss is there. Just provide another. but do not cover the window. Okay, so you see how wonderful and clean, and then when we pull it, it pulls on the kiss. It doesn't pull on the site.